My name's Andre La Gerche. I'm the head of sports cardiology here at the Baker IDI. Heart disease very much flies under the radar in Australia, even though it's the #1 killer of people from middle age onwards. We're doing a lot of research on looking at the long-term impact of very high intensity exercise in athletes. We've spent many years looking at the effect of exercise whilst people are exercising, but the long-term effects of that are still not very well understood. And now we know that some athletes develop heart rhythm problems. We don't know who, why or how to predict those athletes, and so we're wanting to do long-term research looking at that. One of the projects also involves looking at different animal models, including racehorses, because they're one of the greatest athletes in a way. They're bred and trained to exercise at the highest intensities, and we know that they get heart rhythm problems very similar to athletes.
I'm Mick Gayfer, a former Collingwood footballer. I woke up with huge chest pain. It was like I'd been hit, my chest had been hit by a truck. Ended up with 2 micers and two ambulance guys there working on me, and fortunately with medication I got my heart rate down. You know, I always looked after myself in terms of diet, not a big drinker of alcohol, always kept myself fit. So you think you're doing all the right things, but there's uncertain things you don't know about.
The arrhythmias that athletes tend to develop occur in middle age and later, yet the causative factors are when they're training very hard in their 20s. So to make that jump, we need to study them in their 20s and then to follow them through to the period where problems may develop. We're faced with a 20-30 year study, but that's not to say that we start the study and then sit on our hands for 20-30 years, because there's so many questions that can be addressed. One of the main interests from a human perspective is that in horses, unlike humans, we can get some heart muscle tissue, and that's something of a holy grail, because we can only use surrogates or estimates using imaging in humans, whereas in horses in some situations we can actually look at the heart and then see what's going on. The ultimate achievement would be to see some of the questions that we've thrown up as part of our research finally answered. Yeah, some of our research has been quite controversial. We were one of the first to demonstrate that extreme exercise can cause fatigue or dysfunction of the heart, and that it can cause some heart rhythm problems. The only way of settling that question is going to be looking at the health of athletes over many years, and we really need to do that study now, both to answer our own questions and also from a public health perspective.